All right, how do your lungs actually fill with air? Well, you got two options. You can go in through the nose to the nasal cavity, back to this little space called the nasopharynx, or through the mouth and the oral cavity and back to the oropharynx. Then it goes to the laryngopharynx, down into the larynx, which is what your voice box, these are your vocal cords right here, and then into the trachea. Once it comes out of the trachea, there's a split called the carina, or tracheal bifurcation externally into the primary bronchi. And see all these different splits. There's a secondary bronchi and a tertiary bronchi, and eventually the bronchi, which you can see right here with a bunch of cartilage in blue, turns into the bronchioles. And you have conducting bronchioles, you have more terminal bronchioles, and eventually respiratory bronchioles, which are the smallest, leading out to giant alveolar sac, which has, of course, a bunch of alveoli, which are these little bubbles right here. If you look inside of one, these actually fill with air. And if I take a little chunk of a couple of those, this model right here shows you inside an alveoli. And you can see there's holes where the air would spread, but you have capillaries pressed up against the alveoli, which is how the air gets into the blood. So it goes from the outside environment, nose, mouth, down the throat, trachea, over to the lungs, eventually get into the alveoli, these bubbles, and then that is where the blood vessels, the capillaries, are pressed up against, and the gas exchange happens.